Let's talk about blood flow restriction training. What is it and how can it help you? I'm Dr. David Geyer, and I want to help you feel and perform better than ever, regardless of your age or any injuries you've suffered. Okay, I want to talk about a form of training you may not be all that familiar with, and it's called blood flow restriction, or quite simply, the use of a tourniquet while you're training. Now, this is something that, yes, can get you bigger and stronger, but it can also help you recover from an injury. So what is it? Well, you use basically tourniquets or some other ways to basically block blood flow up and down your leg or up and down your arm, and I'll talk about different ways to do that here in a second. But you basically, in the case of a leg, you would put it on your thigh, and basically then you would do low load or low resistance exercises. And we basically, if you're going to do it the formal way, you calculate it. Basically, it's 20 to 30%, some people say 20 to 40% of what's called your 1 rep max. So if you're imagining like a bench press and you can do 200 pounds, then you would basically do 20 to 30% of that. So that would be 40 to 60 pounds for each rep. Now, if it's the leg, maybe it's bench press. And so again, let's say your maximum bench press is 200 pounds, then you would set the leg press machine at 40 or 50 or 60 pounds and then do it with the tourniquet. We're going to talk about some different ways in terms of the number of reps or the number of sets in a different video. But I think this can be really important for a couple of reasons. Sure, by putting the tourniquet on your leg or on your arm, you're putting it on tight enough that blood can get into your arm, but it's not necessarily able to get back. Same thing with your leg. It gets down into your leg, but it's not coming back. Basically, you're blocking venous blood flow, basically blood returning to the heart through your veins, but you're allowing arterial blood to go from up to your heart and the rest of your body down into your extremities. So, and that's where the pressure of the tourniquet gets really important. And again, it's got to be tight enough that it's keeping blood from coming back up your veins, but it's not tight enough that it's basically cutting off all blood flow, arteries and veins, and then you have no blood at all going to your toes and your foot and that kind of thing. Now, again, very good for building muscular hypertrophy, but it's thought to be especially good for people who can't really tolerate the heavy weights. So people recovering from an injury, people dealing with joint pain, maybe shoulder pain or knee pain, something like that, people with arthritis, and it can be very, very helpful. When you put the tourniquet on your arm, or say you put it on the thigh, and then you test muscle strength and look at muscle size in the workouts after that, it seems to have a benefit not just below the tourniquet. So if it's on your thigh, it would be maybe your quads and hamstrings and calf muscles, but it also seems to work the muscles and help the muscles above it. So in the case of a thigh tourniquet, it would help your glutes, for instance. Same thing on your arm. We think if you put it on your arm, and this has been shown in multiple studies, it doesn't just help your biceps and your triceps and your forearms, but it has some retrograde effects on helping your shoulder muscles and maybe your pectoral muscles. So it has both distal, past the tourniquet, and proximal effects. So that can be really helpful on, say, somebody with arthritis of the hip. If they did work with a tourniquet on their thigh and did leg presses or some other exercises I'll show you, it might also help the muscles around their hip, not just below and around the knee, helping with their arthritis pain. Now again, you can use the big fancy devices that physical therapy gyms have, that the tourniquet's connected to a monitor. There's a bunch of tubing, and the monitor's got to be plugged in. If you have access to that, that's probably the safest way to do it because you can specifically set the pressure. If you don't have that, then there's devices you can get online. This is one from a company called Lifting Lab, and I think there's tons. There's nothing special about this. You can even use rubber elastic bands like TheraBands, and that can work really well. You basically set the pressure yourself. Now, obviously, you wouldn't do it over scrub pants or over shorts. You'd put them under your shorts. But basically, you're going to put this on, and you're going to get it fairly tight, and since there's no actual pressure measurement on this, you've got to sort of guess a little bit as to how tight it should be. And the key is you want it fairly tight because it's going to constrict blood flow coming back from your leg, but you don't want it so tight that it causes numbness and tingling. So what you see me sort of cinching it in, and you make it fairly tight. People say if you want to use a pain as a scale, you would want it about a 7 out of 10. And so now I've got it where it's just a little uncomfortable, but it's not brutal. And you know, if you were to see me work out, you'll see this start to swell. It's uncomfortable, but it's not really painful. Is probably how I would say it. There's one essentially for the arm as well, that you would basically slide up your arm. This one acts a little differently than the arm one, in that there's a metal clasp that basically goes around, and then it's got an arm strap to tighten it, and you make it as tight as you need to be. So once the tourniquet is in place, then you start doing your exercises. And I'll show you those again in some upcoming videos. But the key is, again, very light weights, 20 to 40% of your max, of your 1 rep max. So, maybe for bicep curls, you normally do maybe a 60 or 70 pound bar. Maybe you do it with a 30 pound bar, and you're doing high reps, for a period of up to about 5 minutes. There's different protocols that people do. The one that I learned, the traditional one, has you doing a set of 30, then 30-second rest, then a set of 15, 30-second rest, another set of 15, 30-second rest, and then a set of 8, and then you drop the tourniquet. There's all sorts of modifications of that. There's ones where you'll do, say body weight squats, and you'll do body weight squats for 40 seconds and then hold the down position for 20 seconds, and then you go right back into body weight squats for another 40 seconds, and you do that up for about 5 minutes. Sometimes you can alternate 2 exercises. Maybe you do bicep curls in, your 30, 15, 15, and 8, you do 30, and then you go straight to tricep extensions, do that, and then go straight back into biceps, things like that. The total amount of tourniquet time for most of these different protocols is about 5 to 8 minutes. By the time you're done, I'm not gonna lie, it's a little uncomfortable, but it can really produce a lot of benefits for people that are really active and for people recovering from injuries or dealing with pain or arthritis. Have you tried blood flow restriction training? I'd love to hear your experiences. Leave those below. And again, remember the upcoming videos I'll show you ways to use blood flow restriction for building strength and for overcoming injuries. Thank you for watching, and I'll see you next time.